You stood up from the couch, and for 2 or 3 seconds, the room tilted. Maybe you grabbed the counter. Maybe you just waited it out and kept walking, telling yourself it was nothing. Be honest with yourself for a second. How many times has that happened this month alone? Most people over 65 write this off as low blood sugar, or just getting older. But that dizziness when you stand up isn't a normal part of aging, it's your body sending a very specific signal, and in most cases, nobody has ever explained to you what that signal actually means. Every time you shift from sitting or lying down to standing, gravity pulls close to a pint of blood down into your legs almost instantly. In a healthy, younger body, this is handled without you ever noticing. Blood vessels in your legs and abdomen tighten within 1 to 2 seconds, a process called vasoconstriction. Your heart rate ticks up slightly, and your blood pressure stays stable enough that your brain keeps getting exactly the blood flow it needs. I'm Dr. Henry, and today I want to walk you through exactly why that automatic system breaks down after 60, and why the usual advice, just stand up slower, only ever treats one small piece of a much bigger problem. There are actually 3 separate systems inside your body that can fail here, and in a rushed 15-minute appointment, most doctors only ever get around to checking one of them. Before we go further, tell me in the comments, how old are you, and does this happen to you first thing in the morning, or later in the day, usually after you've eaten? That detail matters more than you'd think, and I'll explain exactly why by the end of this video. The first system is called the baroreflex, and it's essentially your body's automatic pressure sensor. You have pressure-sensitive receptors, called baroreceptors, sitting inside the walls of your carotid arteries in your neck and inside your aorta. Their entire job is to detect a drop in blood pressure the instant you stand up, and send a signal to your brainstem to immediately tighten your blood vessels and speed up your heartbeat, so your blood pressure doesn't collapse. Here's the problem. A review published in the American Journal of Physiology on Aging and Cardiovascular Reflex Control found that this baroreflex response becomes progressively blunted with age, and pointed to 3 specific causes: rising oxidative stress in the blood vessel walls, stiffening of the arteries themselves, which makes them physically less able to sense pressure changes, and a decline in how responsive your heart is to the nerve signals telling it to speed up. And this isn't a small effect. The Cardiovascular Health Study, tracking over 5,000 adults aged 65 and older, found that asymptomatic orthostatic hypertension, meaning a drop in blood pressure on standing that you may not even consciously register as dizziness, was present in 16.2% of participants. That's roughly 1 in every 6 people over 65, whether they've ever complained of dizziness to a doctor or not. That same study also found that people with this drop in blood pressure had meaningfully higher odds of isolated systolic hypertension, and higher odds of carotid artery narrowing found on ultrasound. Researchers increasingly use this kind of dizziness as an early marker that prompts a closer look at the blood vessels themselves. What makes this dangerous is that the reflex doesn't fail all at once. It gets slower, year by year, so the 2 or 3 seconds where your brain is genuinely underperfused, meaning it isn't getting quite enough blood and oxygen for a moment, keeps getting longer. There's also a time of day pattern worth knowing. Blood pressure naturally dips further overnight, and the baroreflex is generally slowest to respond right after waking, which is exactly why standing up first thing in the morning tends to be the worst moment of the day for this kind of dizziness. The second mechanism is about how much fluid is actually in your bloodstream to begin with, and this one is rarely explained clearly. As we age, the kidneys become less efficient at conserving sodium and water, partly because levels of a hormone called aldosterone, which normally signals the kidneys to hold onto fluid, tend to decline. At the same time, the sensation of thirst itself becomes blunted, so many seniors are mildly dehydrated without ever feeling thirsty enough to notice it. Less fluid in the bloodstream means less overall blood volume, and less blood volume means there's simply less pressure to work with in the first place, before you've even stood up. Layer onto that the medications an enormous number of people over 60 are taking. Diuretics, prescribed for blood pressure or heart failure, deliberately push fluid out of your body. Alpha blockers, often prescribed for prostate symptoms, relax blood vessels on purpose. Even some antidepressants interfere with the same vessel tightening pathway we just talked about with the baroreflex. None of these medications are wrong to take, but the combination of an already blunted baroreflex, mild chronic dehydration, and a medication actively working against vessel constriction is exactly the pattern researchers keep finding in the people who faint or fall. A study from the American Health and Aging Project, following nearly 1,600 adults aged 60 and older, found that the odds of developing orthostatic hypertension rose sharply with age, with an odds ratio of 2.9 for the oldest participants compared to the youngest in the study. It also found women were significantly more affected than men. 13.7% of women in the study had it, compared to 8.4% of men, and pointed to hypertension and diabetes as major contributing conditions, both of which affect fluid and blood vessel regulation in ways that stack directly on top of the baroreflex decline we already covered. And the numbers get even higher depending on who's being studied. A systematic review pooling continuous blood pressure recordings across thousands of older adults found a prevalence in the general population reaching as high as 27.8%, and climbing past 35% among adults already being seen in geriatric outpatient clinics. In other words, the more health conditions someone already manages, the more likely this fluid and medication mechanism is contributing to their dizziness. But here's what almost no one tells you, and it's the piece that explains why some people get dizzy standing up in the morning, and other people get dizzy standing up after lunch, and assume those are two completely different problems. Very often, it's the same underlying weakness, just showing up at a different time of day. After you eat, especially a meal heavy in refined carbohydrates, a large share of your blood supply gets redirected to your digestive system to handle absorption. In a younger body, the same baroreflex we already talked about compensates for that shift automatically. But if that reflex is already blunted, standing up within an hour or two of eating can drop your blood pressure the same way standing up out of bed does. A systematic review and meta-analysis published in the journal Age and Aging, pooling data from over 3,000 older adults across 13 studies, found that this condition, called postprandial hypertension, affects an estimated 40.5% of older adults. That's actually higher than the standing up from bed version most people have heard of. And it's almost never mentioned in the same breath, because most advice online treats dizzy on standing as one single issue, instead of two separate triggers that both come from the same underlying reflex weakness. So if you told me in the comments earlier that this happens to you more after meals than in the morning, this is exactly why. So what actually helps, beyond the generic stand up slowly advice you've probably already heard? Start with hydration, but be specific about it. Aim for roughly 6 to 8 cups of water spread across the day, not all at once, and ask your doctor whether a pinch of added salt in one glass in the morning makes sense for you. This directly addresses the low blood volume piece we talked about. Next, when you're getting out of bed, don't go straight from lying to standing. Sit on the edge of the bed first, and flex your ankles and clench your calf muscles 10 to 15 times before you stand. This engages what's called the skeletal muscle pump. Your leg muscles physically squeeze blood back up toward your heart, which helps compensate for a slow baroreflex. Compression stockings, the kind that go up to the knee, are another option many people underuse. They physically prevent blood from pooling in your lower legs, and they are frequently recommended in clinical guidelines for exactly this reason. They take some getting used to, but for some people, they make a bigger difference than any of the movement tips. After meals, especially larger ones, build in 20 to 30 minutes of sitting before you attempt anything that involves standing and walking, particularly stairs. And if you're on a diuretic or blood pressure medication, ask your doctor specifically whether taking it in the evening, rather than the morning, might reduce your risk during the day. This is a real conversation to have, not something to change on your own. Now, the honest caveat, because this matters more than the tips themselves. If your dizziness on standing is sudden, severe, comes with chest pain, slurred speech, one-sided weakness, or you actually lose consciousness, this is not a hydration problem, and no amount of ankle pumps will fix it. That symptom pattern needs emergency evaluation, because it can also signal a cardiac arrhythmia or a stroke, and the overlap in symptoms is exactly why self-diagnosing from a video is risky. The added salt suggestion specifically does not apply to you if you have heart failure, kidney disease, or uncontrolled high blood pressure. For those conditions, extra sodium can do real harm, and it has to be a conversation with your physician, not a blanket rule. And if you're on multiple blood pressure medications already, don't stop or adjust any of them based on what you heard here today. The goal of this video is to help you understand the mechanism well enough to have a sharper, more specific conversation with your doctor, not to replace that conversation. So the next time you stand up and the room tilts for a second, you'll know it's not just age, it's a baroreflex that's gotten slower, blood volume that's a little lower than it should be, or a meal your circulatory system is still processing. And now you know which one to ask your doctor to actually test for. If this explains something you've been experiencing and never had a name for, tell me in the comments your age, and whether it happens more in the morning or after meals, because I read every single one. If this helped, a like tells me to keep breaking down what your body is actually doing instead of just repeating, get up slowly. And subscribe, because next week I'm walking through the other reason your legs might feel unsteady after 65, and it has nothing to do with your blood pressure at all.